Hi, my name is Jessie Oxidine, and today I will be presenting my case study, Managing Diabetes in the Geriatric Patient. The case study presentation is Mr. JT, 67-year-old male. He has type 2 diabetes, which was newly diagnosed 6 months ago. Past medical history includes high cholesterol, gout, hypertension, and obesity. He did have a previous history of heavy tobacco and alcohol use, but has quit smoking for the past 10 years and now only has about 1 to 2 beers per week. He presented to the office just for a 3-month recheck of his labs and just following up with his newly diagnosis of diabetes. On his physical exam, it reveals he's 243 pounds. He blood pressure 168 over 102. Regular pulse 84 beats per minute. At this time, there was no clinical evidence of heart failure, peripheral vascular disease, or he wasn't having any gouty flare. On his lab results, it did show a hemoglobin A1C of 8.4%, which it was 8.5, didn't really change much. There was trace protein, and then they did a 24-hour urine collection, and the albumin was 250 a day. His creatinine was 1.2, fasting glucose 156, and all his electrolytes, his PSA and thyroid hormones were all normal. So currently, Mr. JT is at risk for worsening of his disease, heart failure, kidney failure, vision loss, vascular disease, and this was really stressed to him during this appointment, with his diabetes, that he has to control and manage, or he will be at risk for, all these other problems. He is at increased age, so that also puts him at increased risk. So, older adults with diabetes are at increased risk of developing cardiovascular disease. So he was also, just talked about that and explained the reason that he really needs to get his diabetes under control. And just his lifestyle alone puts him at risk. He lives alone. He still works on his family farm about 40 hours a week. He does have a daughter that helps him get his medications, but it's really up to him to actually take them and organize them, day to day. And he does state that he sometimes forgets to take his medications regularly. And then, of course, the diet. He lives alone, and so he doesn't really make the best meal choices, most of the time. Some nights he will eat dinner at his daughter's house, but most of the time he's on his own to provide himself the proper nutrition. And just basically putting him at risk is just his knowledge deficit. He doesn't understand why he has to take these medications. He doesn't understand why he has to eat the certain diet that we're telling him to. Doesn't understand why we got to, check his blood sugar frequently. So these are all the things that we have gone over during this visit. So like I said, we just gave him, we're giving him all of this information and explaining to him the reason behind, making sure that he has his diabetes under control, the disease process, disease management. He was given infographics to help him understand the information at hand. And these were just pretty simple little infographics for him to follow, because once it gets too wordy, we've lost him. So we just find like the most simple way to try to help him understand what we, want to get him to do. We discussed information about diabetes, his diet, importance of medication compliance. We showed him how to check his blood sugar, We talked about how he really needs to get his diabetes under control, and we showed him how to, check his blood sugar or blood pressure, either at home with a at-home cuff, or to go, at a local drugstore to check it. So, he does have his daughter that, cares very much about his well-being and his health, and she was present during this this appointment. So she agrees to, kind of be a little bit more involved and really help him manage his diabetes and help organize his medications to hopefully increase the compliance. And the diet is one of his biggest concerns, because he just doesn't understand the recommendations. And he states that with the nature of his lifestyle, it's hard for him to cook for himself for every meal. So what we did is we discussed initiating the Meals on Wheels service, where he'll get a weekly supply of his diabetic pre-portioned meals that he can reheat himself. With this, the community free Meals on Wheels service, you can pay a fee of $75, and they will, it's like enhanced version of it. So you get to choose how many meals you need in a week, and actually what diet specifications that you need. So money really isn't a problem for them, and so they decided that they will sign up for that $75 extra a month for him to get some of these meals during the week, so it's not so hard on him to have to, do this all himself, or his daughter to have to cook for him every single day. And she also stated that, once a week she'll help take him to the grocery store and make sure he's picking out some healthy alternatives for him to have during the week. Just, if he needs a snack, he has something, within the diabetic diet. Obese older adults with diabetes may benefit from caloric restriction and increase in physical activity, with a weight loss goal of approximately 5 to 7% of his body weight. So these are all things that we definitely did discuss during this visit. We try to refer him to a diabetic clinic, but it was about 30 miles away from the local doctor's office. So he was not interested in that at all. So what we told him that, as long as he will, help control and manage his diabetes the right way, then we won't push the need for him to go to the specific diabetic clinic. And then, we just sat down and we explained every single medication to him and his daughter and the reason for taking the medication. And I think that really helped, because it just shows that, the reason and the importance of each medication. We talked about that he needed, his dilated eye exam yearly, because he has not had one. We helped him learn how to check his blood sugar properly and to keep a log of his results to show at his next visit in 1 month. And this will help us better treat the hyper and hypoglycemia that he has. And he will follow up in the office in 1 month to discuss his progress and all of this and adherence to the plan. And his daughter is planning on coming to that appointment as well. So just some long-term and short-term goals for Mr. JT. Just making sure he's checking his blood sugar like he's supposed to, and documenting it in the log. Compliance with his medications, healthier diet and lifestyle. Long-term goals is we really want to see his hemoglobin A1C below 7. His blood pressure not to exceed 140/80, a decrease in his cholesterol, his triglycerides, and maybe some sort of weight loss. An overall goal of maybe 30 pounds in maintaining that healthy BMI. So the rest of these slides are just my SOAP note. So, and basically everything that I just discussed is in the SOAP note. It's just in the proper format, but it goes on. It's my SOAP note. My reflection for this patient, this was a pretty interesting patient because I was able to touch on multiple aspects of his care and his current diagnosis, all while including some community resources. This patient was a prime example of what a little information, teaching, and support will do to his overall care and health. Mr. JT is very sincere about making the necessary life changes to take control of his health and live a long and happy, healthy life. He understands the task at hand in order to get his diabetes under control and the consequences if he does not. His daughter was very helpful and eager in, helping her father make the necessary lifestyle changes. Mr. JT has a strong will to survive and to live his life to the fullest. He enjoys his life and the time he gets to spend with his family, especially his 4 grandchildren. I suspect a great deal of improvement in his overall health during our next appointment. And these are references. Thank you so much. And sorry about my voice. I have a terrible cold. Hopefully you can understand me.